So it is now my pleasure to introduce the incoming president of the Texas Medical Association, my friend Dr. Carlos Cardenas from Edinburgh, Texas. Dr. Cardenas is a board-certified internal medicine specialist and gastroenterologist. He has more than 25 years of experience in medicine and healthcare management. Dr. Cardenas was raised in McAllen and earned his bachelor's degree in biology from Austin College in Sherman, Texas. I have to point out, I am also a graduate of Austin College in Sherman, Texas, so we have back-to-back kangaroos running the organization. I also have to point out that Dr. Cardenas will be the 6th student from Austin College to become a TMA president. Pretty good for a little small liberal arts college. Following his undergraduate studies, he attended and graduated medical school at the University of Texas Medical Branch in Galveston. He began his medical career as an intern and resident at Scott and White Memorial Hospital in Temple, Texas. He co-founded South Texas Gastroenterology Associates in 1992, where he is actively practicing. Dr. Cardenas served as the president of the Hidalgo Star County Medical Society in 2001. Dr. Cardenas served as the chairman of the board of Doctors Hospital at Renaissance. He serves as the chairman of the board. Under his tenure as chairman, Doctors Hospital has grown from an outpatient facility into a 506-bed general acute care hospital with 17 facilities. Doctors Hospital has provided in excess of $1 billion in community economic benefit over the past 3 years and employs more than 3,000 people. DHR is one of the largest physician-owned facilities in the United States and offers some of the most comprehensive medical care on the U.S. southern border. Dr. Cardenas joined the TMA in 1981 as a medical student. He was appointed to the Council on Legislation in 2000 and served until 2005 when he was elected to the TMA Board of Trustees. He served as the chairman of the board of the TMA trustees in 2013. He has been an active member of TexPAC, the TMA Foundation, and the Border Health Caucus. Dr. Cardenas, will you join me at the podium? It is my great honor to administer the oath of our office to Dr. Carlos Cardenas. Please raise your right hand as if we were swearing in the Supreme Court Justice. Dr. Cardenas, do you solemnly swear that you will carry out the duties of the office of President of the Texas Medical Association to the best of your ability, that in all your activities you will uphold the principles and policies of the association, that you will promote unity and cooperation among county medical societies and members of the association and the Texas Medical Association Alliance, and that you will dedicate yourself and your office to accomplishing the association's primary mission, improving the health of all Texans? I do. Both of you? You do. Good. So congratulations, Carlos. I used the metaphor yesterday in the past president's luncheon that being the president is like being part of a relay team, like the 4x400 yard dash. I've carried the baton for a year. I'm passing it on to you, and now instead of a 4x400, you are the 152nd person in the relay race. When I was running 4x400 relay races at Austin College, I was always happy to pass the baton to the next person, not because I was the end of my lap, but because I know he was faster than I was. And with that same confidence, I passed the symbol of the baton, the president's pen, on to you.
Wow. Good morning. That was weak. Let's try it again. Good morning. Much better. That's kind of like the yays and the no's. I kind of like that. That's great. I want to thank you. I want to thank this House for giving me the opportunity to serve. I want to thank my wife, Chris, and our sons, Adam, Simon, and Daniel, for all of their love and support, or I wouldn't be standing here. Simon, our middle son, was unable to join us today because he's taking final exams. I also want to thank my mother, Darda, my Aunt Sylvia, my parents in heart, Ralph and Evelyn Tiboletti, as well as my sister-in-laws, my brother-in-law, and all of the Tiboletti, as we say in Spanish, parches, for being here today. A special thank you as well to Dr. and Mrs. Robert Allen and fellow Renaissance rocker, Dr. Noe Oliveira, for taking the time to be here with us. I also want to thank Father David Garcia from San Antonio for giving the invocation at the opening of the House of Delegates. I'd like to make some special acknowledgments. I want to acknowledge my father, Ruben Cardenas, for being my dad and setting the example. He was not able to be here today. I want to acknowledge some role models. Fernando A. Guerra, MD, Mario Ramirez, MD, Rafael Garza, MD, Marvin Tavares, MD, and his brother Hiram Tavares, MD, for being my role models. I want to acknowledge all of the TMA leadership, past and present, for providing guidance, support, and leadership to me and our great organization. I want to recognize Senator Dawn Buckingham for her courage in filing legislation to support the repeal of maintenance of certification as a discriminatory criteria for maintenance of privileges or licensure. I also want to recognize the TMA Alliance for their support of our profession, their advocacy, and their unwavering commitment to community. I want to acknowledge my partners and staff at Renaissance Gastroenterology, Dr. Subu Behara, Dr. Asif Zamir, Dr. Ingrid Chacon, Dr. Murthy Badiga, Dr. Henry Herrera, Ms. Pamela Garcia, nurse practitioners worked with me for 14 years, Luisa Marquez, our medical assistant, and their commitment to me and their unwavering support of the things that I do for this organization and our community. Without it, today would not have been possible. I also want to acknowledge the leadership and staff of Doctors Hospital at Renaissance in Edinburgh, Texas, who have made dreams come true and continue to be a source of inspiration for patient-centered care that is managed by physicians. My gratitude goes out to the greatest staff in organized medicine, all of our TMA staff, past and present, without which none of today or anything else that we do would be possible. Please give them a round of applause. As you just heard, Don mentioned that I had earned my MD degree on the island. Some of us called it the Rock, at the University of Texas Medical Branch at Galveston. I'm curious, how many of you are UTMB graduates? Would you please stand? How many of you received, stay standing, how many of you received an MD or DO from one of the other Texas medical schools? Would you please also stand? And how many of you graduated from a medical school in another state or another country? Would you please stand as well? Remain standing. We need calisthenics this morning. So now, look around you. With the exception of the medical students who will be joining us soon enough, every one of you is standing. Every single one of you put in the time and enormous effort it took to earn a very distinguished degree. Give yourselves a round of applause. Now you can take your seats. Yes, each one of us worked very hard, not just to be able to put those letters after our names, but for the rights and privileges that come with those letters, the right to prescribe potent medications and therapies, the right to put someone to sleep and then use a knife to cut somebody open. Doing something like that outside the bounds of our profession would be assault and battery. As physicians, we have the privilege of helping a mother bring new life into the world and being there when her child takes that very first breath. We also have the privilege of sitting beside an elderly gentleman who has made many marks in his life, holding his hand as he takes his last breath. And we get to do all of that because of the amazing nature of the patient-physician relationship. From a well-child exam to the most complex surgery, from administering a flu shot to listening intently and personally when an otherwise healthy middle-aged man shares with us his symptoms of depression. For our patients, that relationship means trust. Trust that we will listen faithfully and do what's right to help them heal and mend, or make the best of their final days with as little pain and suffering as possible. For physicians, for us, that relationship means responsibility, because with those rights and privileges that accompany our status, with those rights and privileges come serious duties and responsibilities. We have the right to ask our patients the most personal of questions and the duty to honor their confidence, to protect their privacy. That's a duty that predates our HIPAA laws by centuries. We have the unequivocal responsibility to put our patients' best interests first above our own, above any insurance company or hospital or governmental agency. It is our duty to fight for our patients' best interests, and we do all of it willingly because of the incredible energy we draw from doing our jobs, from the patient-physician relationship. That energy is what enables us to respond to a call at 3 in the morning. That energy is what enables us to deliver bad news. It's that energy that enables us to make the very most of 15-minute appointment slots that really should be 2 or 3 times as long. That energy, combined with our education, skills, and training, is what gives us the confidence to be able to drill a hole in someone's skull, thread a catheter into someone's heart, make the tissue diagnosis of cancer, or to transplant an organ and save a life. Taken together, those rights and privileges, those duties and responsibilities, that energy that comes from the patient-physician relationship, taken together, it defines us. It is who we are. Healers, educators, and caregivers, all of us who make up this house of medicine. It is who we are that sets us apart. There are others, many of them, nurse practitioners, pharmacists, chiropractors, insurance executives, and hospital administrators who want to be who we are. Many others want the rights and privileges that we have earned without the work and sacrifice it took for us to get here, and without the duties and responsibilities that fall to us as well. This is who we are, not just individually, but collectively as well. As a great organization of physicians, it is who we are as the Texas Medical Association. I think at TMA we recognize that probably better than most other organizations because we are a bottoms-up organization. We are from the grassroots. Who are the grassroots? We are the grassroots. Every member of our association is who we are. And who we are is our patients' defenders, our patients' voice. Think about it. Every time we approach a legislator or a judge or some faraway insurance company official, every time we make an argument about health care in this great state, we put it in terms of our patients. Unfounded scope of practice expansions are assaults on the patient quality of care. Defending tort reform and fixing the Medicaid mess, that's how we embrace our duty to expand patient access to care. Stepping up for immunizations or against tobacco are opportunities to keep our patients healthy and safe. But remember this, the Texas Medical Association is a living, breathing, nimble organization that exists in every corner of this state. We are 50,000 strong. Many members may not have the time to come to Austin or Washington to participate in what we do, but are out there doing it every day and making this a better place for all of us to live in. That's who we are. Physicians are the beacon of health in our communities. We stand up for the health of our community, not just what we do at the bedside, but what I like to call the bigger, the greater bedside, which is our community, where we live. Our job is to create a healthier community, a healthier environment for our children and our grandchildren to grow up in so that we can stamp out suffering and disease. In each of us, We have the duty and responsibility to stand up for our individual patients. We have that same duty and responsibility to stand up for all of our patients, to put the health and best interests of our communities first, to stand up for clean air, clean water, and good hospitals, to take part in immunization clinics and provide physical exams for student athletes, to educate, push, and cajole our community leaders to do the right thing, make the right decisions. Those are the stories that need to be told in every community, because no community can exist without a strong, healthy environment and a leader to stand up and cry foul when necessary. It is up to us, the physician leaders, to chart the course for the health of our communities, and when called upon, to be the voice for the voiceless. It is who we are. And you know, it's not always an easy thing to do. We live in a world where politics trumps policy. We live in a world where, despite our degrees and our professional standing, we are quite often the Davids standing in the field with a slingshot. That means sometimes we have to take some risks to stand up for what's right for our patients and our profession. But no pain, no gain. With risk can come great reward. When the physicians of South Texas decided to march to our courthouse to demand an end to the epidemic of medical liability suits, to put a stop to the lawsuit lottery, we were warned. No, don't do it. It's too risky. You guys really sure you want to do this? But when you're getting shot at all the time, when 70% or more of your colleagues are named in a lawsuit and you can no longer recruit, retain, or attract people to your community to do what needs to be done for the health of your community, something had to change. That was the something that drove us to stand up and say, no more. I can't think of a prouder moment in my professional life than when we marched on the courthouse with all of our colleagues and had a day of awareness where we shut our practices down but wouldn't allow a single person to fall through the cracks in the emergency room. We stood shoulder to shoulder with our colleagues, our patients, and our staff to demand redress from our government. And a statewide movement grew out of that march, a statewide movement that led to the passage of some of the country's best medical tort reform laws, laws that stopped the lawsuit lottery, laws that brought down our insurance rates, laws that helped us bring the specialists we needed to South Texas, East Texas, and rural Texas. Risky? No question. Worth it? Absolutely. Or years before that, when a group of young physicians in South Texas decided to pool our resources, take out a loan, and open our own surgery center. It made sense. It was a hedge against the future. We saw the changes that were coming and knew we had to do something for our patients. We couldn't sit by, for example, and watch charge nurses going away, more and more patients being assigned to fewer nurses to care for them, and our patients' health suffering for it. How else would we be able to control what was going to happen in our future if we didn't have an opportunity to work on both sides of the equation? Not just as a physician, but also as a person who administered the hospital or the surgery center. It made perfect sense that physicians should own their own day surgery centers. We should own our own hospitals. We can run them better than the people who are in the hospital administration business because we are the ones who do the patient care. It is who we are. We are the ones who should make the decisions about which equipment to buy, how to staff a unit, so if what we really wanted to do was grab the mantle and take charge of healthcare quality and control, it was only natural that physicians should own their own hospitals and clinics. I invite each of you to come to Edinburgh, Texas, to see the hospital that we have built, to see the quality controls we physicians have put in place, to see the kind of care we can provide without someone else telling us how to do it, because that's who we are. Risky? No question. Worth it? Absolutely. Today, tomorrow, for the next year and for the years to come, we will all be asked to take risks, worthwhile risks for our patients. It revolves around a nexus. And that nexus is the care of our patients and what happens in the exam room. The policies we craft and the direction we chart all evolve from the bedside. If we do that right and we stand up for the right reasons for our patients, the rest of it will take care of itself because we have a bond, a very special bond. And all the bureaucrats can do whatever they want to do, but they can never have what we have or do what we do. That's what it comes down to. It still comes down to taking care of one patient at a time. That's the wellspring for our energy and our hope and our ambition. Because that, my friends, is who we are. We are the Texas Medical Association. Thank you.